I was so excited. Can you imagine? I'm sitting there and the laboratory results are coming in and they're like, wow. And then another and another. So that was the first thing. Then the weight. So we're all meeting every Monday night and we got the scales and everybody gets weighed every Monday night. And the weight started falling off people. It really did. And then all sorts of other weird stuff started happening, some of which I couldn't make sense of for years. The first one was, people said, are you hungry? Because I'm not. And they started saying things like, do you have to eat breakfast? And I wasn't hungry. I wasn't hungry. They were telling me the truth because I was experiencing this with them. Why are we not hungry? That's so odd. And I was not bothering with breakfast, so I didn't eat it. You don't have to have it. And my belly went away. The next thing was, I noticed when I stood up from my desk, I felt dizzy. Weird. Now, I hadn't told anybody, but I had moderate high blood pressure for years. But I didn't like to be a patient. Mm-hmm. So I never went to a doctor. I just put my head in the sand. So I had high blood pressure for years. When I took my blood pressure, it was low normal. Why? I didn't know. But on the patients as well, I'm doing that as well. I'm measuring all the blood pressure and it's improving. So it's getting weirder and weirder. Liver function improving, weight going down, blood pressure improving. In those days, the blood test that we did was a thing called a hemoglobin A1C. The A1C in America, this is the average sugariness of your blood for the preceding 3 months. So the results take a while. Mm. But then when the hemoglobin A1C came in, there it was. We were getting really spectacular improvements in average blood sugar. And that's kind of how it began. So that's 2013. So that's 13 years ago. And the rest is history. But I was completely blown away. And I was full of curiosity about all these other things and how was it? Why were these things improving?